New developments tonight, clarification from the Department of Health and Human Services about the Trump administration freezing federal child care funding to Minnesota over suspected fraud.
Late tonight, we were told funding's being frozen to every state, but the catalyst is Minnesota. And what the feds are doing is asking for proof the money is being used illegally and for its intended purpose.
Nearly a year ago, our Jay Cole started asking questions about taxpayer-funded daycare centers actually going door to door. Why were they still receiving millions of dollars despite repeated safety violations? And were there actually children attending them? Tonight we have team coverage. Our Ben Henry spoke with a Republican lawmaker demanding transparency from the State Department of Human Health and Services.
But first, Renee Cooper is digging into the impact of federal child care funding being cut. Renee?
Well, Kevin, this move is expected to cut child care assistance to families in half. In Minnesota, it's funded about 50% by the state and 50% by the federal government. And that federal and state money is distributed down to counties who then disperse it to child care centers to cover tuition that lower-income families apply for.
Child care assistance funding follows the family, not a provider. And families have to go through a really arduous verification process and submit a ton of documentation that is verified by the state or the county in order to be deemed eligible for child care assistance.
That's Claire Sanford with the Minnesota Child Care Association, which is the organization that represents licensed centers statewide. She says 30,000 Minnesota families rely on that funding every month. Now, U.S. Health and Human Services tells us they allocated $185 million to Minnesota for child care assistance in 2025. Now, that money includes that family child care assistance, but it's part of a larger child care and development block grant. And according to Sanford, that means money for daycare licensing, professional development, safety training, and to pay for some regulators who keep tabs on whether providers are following the law is also frozen.
If you have a doctor who commits malpractice in the emergency room, you don't shut down the entire emergency room and turn everyone away at the door because they need those services. And that's what this feels like. If there are bad actors, they need to be found, they need to be dealt with, but the vast majority of providers and families are trying to do the right thing and rely on childcare for their safety, their nutrition in some cases, their ability to work.
Now, a spokesperson for USHHS tells me that he believes money has been allocated to Minnesota through January, but the federal funding freeze stops anything beyond that effective immediately. He says that's until the state provides attendance and other requested provider records to their office. Live in the newsroom, Renee Cooper, 5 Eyewitness News.
All right, Renee, thank you.